There's been a lot of misinformation about so-called cuts to Medicare contained in the Affordable Care Act, and we hear this number, $716 billion. The truth is these are reformed ways that we're paying providers and how they take care of patients. Changes to Medicare included in the Affordable Care Act include targeting inefficiencies in the system to make it more sustainable for today's seniors and tomorrow's seniors. It reforms payments to private health insurers, reducing inefficient payments to hospitals. But really, when we talk about benefits to Medicare recipients, the Affordable Care Act increases benefits for seniors, including new wellness exams that are without out-of-pocket costs, preventative screenings without out-of-pocket costs, and reduced pharmaceutical costs for seniors in the Medicare Part D program. We've heard a lot in the media about the individual mandate and how it's a loss of freedom. But what we haven't heard is that in Massachusetts, the mandate was put in place in 2006. In the last 6 years, it's affected 2% of Massachusetts residents. And these are people who don't already have insurance from their employer, or Medicare, or Medicaid, or their veterans benefits, or active military benefits. This is going to be a very small, narrow part of the population. And the individual mandate is going to encourage shared responsibilities. No longer will people get life-saving, expensive care in the emergency rooms and pass along those costs to those who are insured. The individual mandate is simply shared responsibility for the American people. If the Affordable Care Act is repealed, millions will suffer. Whether we talk about young adults who are now able to stay on their parents' plan until they're 26, or the 48 million Medicare recipients who now can access preventative services without out-of-pocket costs and have savings for their prescription drugs, whether it's the tens of millions of Americans who are about to receive rebates because their insurance companies overcharged them, or the millions with pre-existing conditions who are unable to obtain coverage prior to the Affordable Care Act. This is an issue of fairness, and millions will suffer if we repeal the Affordable Care Act.